like to welcome you all. I know that many of you have travelled from quite some distances.
Well, I didn't really know anything at all about the system apart from more or less the name and a few little bits from the flyers. So finding out exactly how it works in practice and seeing the demonstrations on the iPad was a really helpful thing to do.
I think the richness of this conference comes with talking to the other fellow users and finding out how they've been using, and of course their struggles as well as their victories.
We're all struggling with the same things about trusts and whether people have Wi-Fi access or not, or how patients react to people having mobile devices. All those kind of things are in common, and it's good to know how other people have solved those problems.
It is a solution to a problem that does exist. Their system of clinical sort of monitoring and on-the-fly feedback is something I'm very, very impressed with, actually.
The immediacy of the offline feedback, basically, so being able to complete an observed form there and then rather than having to wait until you're back at a PC, for example.
The solutions that we're looking for at the moment are a means of capturing the fact that students have been signed off on clinical skills, knowing which students haven't signed off, and means of being able to see those, and for the students to have some kind of overview of the fact that they're one of 5 that hasn't signed off, or one of the 95 that have.
I think the people that's going to benefit most are going to be the students and the clinicians, because in terms of it's a time saver as well as an opportunity to increase the amount of data we can A, give and B, capture, and you're also then able to sort of mine the data that you're receiving for a lot more information than you'd have ever had time to receive before. So actually it's an all-rounder. I think it's a beneficial program, in my opinion, anyway.
The electronic system allows both students and the staff that need to be able to support them to see how they're getting on an ongoing basis, and to intervene just in time if there are any issues. We've used it for medicine and for therapeutic and diagnostic radiography, which have very different setups in the way they work, and it's been able to adapt more or less to both ways of working. And we've also used it for a co-curricular award that is very different again, so it has that flexibility.
Papers gotten lost, for instance, or I think it's a tool. It's a helpful tool for fieldwork placements.
Why did we actually choose this? One of the reasons is it doesn't need any Wi-Fi at all, and that's actually really good, because if you're going into the trust and actually asking about governance, you just go into them and say, well, it's not running on your network, it's got patient information on it, we're just actually converting the paper documents to digital documents, and the governance officers were all fine with that.
We've just come to the end of our first year really using it in earnest. We've provided the students with tablets. By putting an institutional Google account on, IT were able to remote enforce that they were encrypted, but without actually locking down the tablets. So the students can have their own Google accounts and still install apps and use it for the things that they want to do. So we want to encourage them to use it for other aspects of their studies as well.
One of the things that doctors really have to do all the way through their career these days is provide evidence to support applications. So when they come to 4th year and start applying for foundation year jobs and things like that, they actually can build up in My Progress a whole set of evidence that they can use to support that application.
Hopefully my showcase will be in place, so that's a big thing, I think, a big issue, if you want to go from teacher-centered learning to student-centered learning.
I think one of the key things about the whole thing with My Showcase is back to this thing of personalisation of learning. The fact that they can use their WordPress blog posts, or they can use a YouTube video, or bring in their Evernote notebook, and that they own that content and they can then present it wherever they need to us was again a big win. And when you're working with busy clinicians, having clunky systems like most healthcare systems are, is really not a very good place to be in. So usability is a key thing, and that's what we saw straight away with My Showcase.